Hello, my name is Goyal, and I am a non-invasive cardiologist and an associate professor of medicine at the Emory University School of Medicine in Atlanta, Georgia. I also serve as the Chief Quality Officer for the Emory Heart and Vascular Center. At Emory Healthcare, we currently have 9 hospitals within our health system that are treating COVID-19 inpatients. The COVID pandemic has greatly accelerated our foray into telehealth. As of March 15th, under 1% of our outpatient encounters at the Emory Heart and Vascular Center were telehealth visits. As of today, April 29th, 80% of our outpatient encounters are telehealth visits. Regarding elective cardiovascular tests and procedures, we stopped doing these on March 16th. And now 5 weeks later, on April 20th, we have reopened some, but not all of our elective slots in order to reduce backlog. As we reopen our doors, we are learning the following lessons. First, it takes more time and planning to ramp back up elective visits and procedures than it does to turn the switch off. And despite our reopening our doors, many patients are choosing to defer seeking chronic disease care. Second, in case of another COVID surge, we must have a resilience plan where we can ramp back up our COVID capacity and ramp back down elective encounters and cases. Third, even in the midst of reopening, we must continue to practice safety, including the use of proper PPE for COVID patients and social distancing and masking for non-COVID areas. Despite the continued linear rise in COVID-19 cases throughout Georgia, our governor has discontinued stay-at-home orders and reopened businesses in Georgia as of April 24th. We therefore anticipate a second peak of COVID, especially from rural areas. We at Emory Healthcare are working both with the U.S. Centers for Disease Control and the Georgia Department of Public Health to track COVID cases. We're also offering COVID-19 antibody testing to our caregivers, even as we're still learning how to interpret these antibody tests. Some of us have been dealing with this pandemic for almost 2 months, and it is human nature to begin to let our guard down. Let us encourage each other to continue safe practices such as social distancing and masking for a while longer, for the benefit of our patients, our families, and our own health. Thank you.